Good afternoon, everyone, and a very warm welcome to our today's session on the workplace safety and workplace safety and health. I'm Shraddha, part of a wellness team at Prudent Insurance Brokers, and our today's speaker is Dr. Mabel Wasnik, who has more than 2 decades of experience into the emergency medicines with Manipal Hospital and specializes into the trauma management. So I would request Dr. Mabel to take over the platform and share an insightful session with all of us today.
Yeah. Hi, good afternoon. I'm happy to be here, happy to be taking the session for you all. I've talking about the secrets to workplace safety and health. I was told that today's topic should be workplace safety and health. So in the next 1 hour or so, let's discuss a few things that are important towards workplace safety and health. I don't want that. Yeah. Okay. So what I'm going to do is, excuse me, I'll talk about the importance of safety. And then importance of health. So for us to have good health, we'll have to have good hygiene practices, nutrition and exercise. And then I'll talk about cardiopulmonary resuscitation and also a little bit about a heart attack and stroke and how we do first aid for these things. And after that, I'll be happy to take your questions. So why is safety in the workplace important? It is important because according to us, because a lot of surveys have shown that more than 4.1 million workers suffer a serious job-related injury or illness, which is a huge number, okay, according to a survey every year. And that is why it's very important for us to make sure that our workplace is safe and to also make sure that we do everything to have healthy lives. And obviously, if we're healthy, then we're going to be healthy at work also, okay? So the safety precautions, what do safety precautions do? So if towards workplace safety, what's important is to take precautions. You can see in the picture, you can see a helmet, you can see personal protective devices, you can see masks, you can see gloves. So safety precautions definitely reduce damage to machine as well as property, and it minimizes injury and illnesses. So if you take proper precautions, then your injuries will be less, illnesses will be less. It boosts workplace morale. You know that if there are accidents, like even here, we see that if our colleagues have accidents, then morale is low. Okay, so workplace safety definitely boosts workplace morale and reduces the costs of injury. We all know that prevention is always better than curing something. Yeah, and it then improves the image and the reputation of the company. Yeah. So what are the critical safety risks that we are looking at? Noise at the workplace. Now, see, you all are not a machinery company, isn't it? So I will talk about what I feel is applicable to you all. So one is noise at the workplace. I'm not saying your workplace is noisy, but these are the different risks that one would face. What do large decibels of noise do? They affect us. They affect our concentration. They stress us. Okay, we're not able to do what exactly we want to do. So it decreases our productivity. It also has an effect on the ears, on the eardrums, on the brain. Okay, so noise at the workplace has to be minimized in whatever capacity we can. Hazardous substances. So if we come into contact with hazardous substances, small things like acids, spillage, all that would be hazardous towards our health. Confined spaces. A lot of people are claustrophobic, and even if you're not claustrophobic, it's always nice to have a large area. No, it's nice to have a sense of space. So closed spaces, confined spaces can definitely be detrimental to both our safety as well as our mental health. Extreme temperatures. Because of the air condition, sometimes it is very cold and very uncomfortable. Also, extreme heat. Say the AC is not working, there's no proper ventilation. It is uncomfortable and it is also can be a health hazard. Slips, trips, and falls down the steps. See, a very important measure when you're walking down a step, when you're walking down the steps, even if the phone rings, do not take the call. You can always call back to the person, because, or don't look at your messages when you're walking down steps. Do not, look at your WhatsApp when you're walking down steps, because that's a big big area where accidents occur. Now, having said that, it's an advantage to our health if we take the steps, if we don't use the elevators and take the steps. So even if you're say you're working on the 10th floor, then take four flights of steps and then take the elevator. So take steps as much as possible. But if you're taking steps, and if you're climbing down the steps, you can climb down 10 floors. You do not need to take the elevator, because you're not going to be tired climbing down steps. Very, very important for health is to use the steps. But when you're using the steps, please do not slip and trip and fall. Also, water in the workplace, we can cause water spills, can make us slip. So we have to be careful about that. So what are the general precautions that we would take? Keep the workplace clean and organized. So if your workplace is clean and organized, then chances of coming into tripping somewhere, hitting something that you're not looking for, you don't know that something is there and then you hit it, you fall, will be avoided. Store combustible materials properly. Then there are no fire hazards that can occur. Put signs for hazardous zones. If there is something that is not safe, then a sign is very important. Use labels for hazardous materials. Beware of fire hazards. When in doubt, ask your supervisors or managers for guidance. And be well versed in providing first aid. I'll be talking a little bit about first aid. Okay. Regularly service machines and tools. So whatever our machinery is there, our tools are there. Even if you're not using computers, you regularly service it, because then, you don't know about electrical connections. Yesterday when I went home and I was using my computer at home, I kind of got a shock. So it's not that because it's a computer, it's not a hazard. So you have to make sure that everything is serviced and electrical connections are seen to and, checked on a regular basis. Reduce workplace stress. So a big health hazard, a big safety is when you is not having stress. Okay. So safety is not only about machines. It's not only about about machinery, about hazardous materials. It's also about stress. So workplace stress will cause a lot of damage to us and hamper our safety. And take scheduled short breaks. Having said that, we work for this many hours a day. If you take a short break, just maybe to drink some water, I'm not even saying drink coffee, drink some water, or just walk around the premises, it's good for your mental and physical health. Okay. So that is the importance of just a little bit on safety and how we have to look after our premises and make sure that our workplaces are safe. Okay. In this COVID time also, safety would mean that if someone is not well, they're having a cold, they're having a respiratory symptoms, wear a mask and come to work, or don't come to work at all. We are seeing a recent surge in our COVID cases, and you know that any respiratory tract infection is very infectious. So that's important. One more aspect of safety is to make sure that if you are not well, you would not give it to your neighbor. Okay. So importance of hygiene. Maintaining hygiene at the workplace is very vital for protecting the employee as well as the product quality. Okay. So hygiene is very important, whether it's workplace or at home or anywhere. It's reported, you get me coffee from. It's reported that sick leave costs millions of rupees to small medium enterprises. So obviously, if if you have an illness, then you will have to go on sick leave, and that would be a lot of cost. Good hygiene practices reduce the likelihood of spreading potential pathogens within the unit. And better hygiene practices would definitely have better health for employees, and they would help prevent the spread of infectious diseases. Okay, so common ways in which diseases are spread. To prevent, if we actually want to prevent the spread of any infectious disease, we need to know how the disease actually spreads. So, direct contact transmission. So you blew your nose, or you coughed, and you've not washed your hands. Thank you. You've coughed, you've not washed your hands, and you shake somebody else's hand, then for sure you're going to transmit the whatever virus or bacteria you have. So that's direct contact transmission. Indirect contact transmission. What is indirect contact transmission? You sneeze or you contaminate the doorknobs, the towels, the windows, your keyboard, okay? Any objects at the workplace that are not well sanitized. So what do? Use the sanitizer and sanitize whatever you have touched. The next is vehicle transmission. So what is the vehicle I'm talking about? Water. Water can transmit a lot of diseases. You can get diarrheal diseases because of water transmission. Food transmission, contaminated food. Air transmission, droplet infection. So all these, the bacteria or the virus would come to us through a vehicle. Okay, so the vehicle would be the water, food, or air. Vector transmission. So you can have a mechanical transmission or a biological transmission. So these are all the common ways in which diseases would spread, and we'd have to be careful about it. So what are the strategies to prevent transmission of infectious diseases? How would we prevent their spread? Follow strict hand hygiene. And when we actually teach hand hygiene, we say that, I'll just quickly go through the steps. Wet your hands and apply soap. Rub your palm to palm, okay? And rub your palms with the fingers interlaced. Scrub the back of your hands. Very often we scrub the front, but we don't scrub the back of your hands. Base of your thumbs. Wash fingertips and fingernails. Keep short nails. Rinse your hands with water and always dry your hands with a towel. Wet hands can pick up an infection and are not clean. So always dry your hands, because the dry hands are what we have to aim at. So that's about hand hygiene. Use of personal protective equipment like gloves, masks, eyewear is important because it's protective. Even if you wear glasses that don't have a number, it would protect you if necessary. Respiratory hygiene, cough etiquette. When you're coughing, cough into a tissue or cough into a handkerchief. Don't cough on other people, because that's how the virus is transmitted, through droplets. If you have a cut or a bruise, wash and bandage it. Don't come to work with that cut or bruise open. Okay? You can have an insect, you can have a fly that sits on it, contaminates it. Okay? Do not pick on healing wounds and blemishes. So if your wound is healing and there is a scab, the scab is there and prevents any infection from going in. So do not pick it out. Avoid sharing food, dishes, or eating utensils. What do we mean by avoid sharing food? Don't eat from the same plate. Don't use the same, the same vessel to eat. It's better that each one would have their own plates. Don't drink from the same cup. Clean and disinfect commonly touched surfaces, which is easily done, especially your workplace. You can easily have a sanitizer. Use the hand sanitizer to just sanitize your place that you're working at. Follow food safety in canteens, cafe, at the workplace. Okay? And it's important to maintain cleanliness at common workplaces and in the meeting rooms. Okay. So what are the recommendations, again, for good hygiene practices? Every day, employees, remember, when you go to work, you are exposed to contaminants in your workplace. In your travel, you go by the metro, you're exposed to a lot of contaminants while you're traveling. 80% of common infections are transmitted by touch. and hence it's very essential to maintain personal hygiene. Okay, so personal hygiene is very important. So what is your personal hygiene? Like hand washing habits, wearing clean clothes, maintaining proper oral dental hygiene, and cover wounds or skin infections. Okay. So a few do's. Do's are use your handkerchief or cotton napkin to cover your nose and mouth when sneezing, coughing, wiping or blowing your nose. Hand hygiene before starting work, before putting on gloves, before eating or drinking everything, cooking anything. You can't imagine how useful hand hygiene is and how it works as a very good preventive measure in any infection. Do adhere to the company's hygiene policy, follow the required plan and strategies. So there would be some written down plan or SOP. Wash your hands after eating, after you touch your face, hair, etc. When you touch something dirty, when you handle trash, keep storage areas clean and increase the ventilation in your workplace. Throw waste in waste bins only. So what are the few don'ts? Again, the same thing becomes a don't. Don't sneeze without covering your mouth. Don't reuse tissues. Do not leave the washroom without washing your hands. Okay, so don't disrupt the cleanliness policy. Work area should be uncluttered, and dirty cups, messy dishes should be put in the right places and not left around the work area. So this point is very important. When you are sick, stay at home, because if you come to work, whether you have a diarrheal disease, whether you have a fever, a cough, when you come to work, you're definitely exposing someone else to the to whatever you're going through. Okay, so health is very, very important to us. Focusing on health in every workplace comes to employees and the employer's benefit. So being healthy does not only mean being disease free. Okay, so being healthy just doesn't mean that you don't have a fever, you don't have a cough or a cold, you don't have a diarrhea. So what is being healthy mean? Can anyone tell me? I mean, sorry, I guess because it's a webinar, because it's online, you all can't tell me, but whatever. So a lot of the lifestyle diseases like diabetes, hypertension, all this heart diseases is all because of it's all because we don't maintain our proper health. Okay, so 40%, 46% of the workforce suffers from some or the other health related issue, including 43% with a skewed BMI and 30% with a diabetic risk. So 46% suffer from health related issues. Diabetic risk 30%, okay, and many patients have a skewed BMI, so we have to maintain a proper BMI. So see, lot of patients are out of this 27%. So healthy employees are more productive and efficient with their work. So even if you have good health, if you don't have lifestyle diseases, then you definitely are more productive and you can be more efficient. Okay, so how do we achieve this? We achieve this by workplace health initiatives. So all workplaces, if they have health initiatives, the sick leave will reduce, absenteeism will reduce by it's found to reduce by 27% worldwide. So what are our workplace health initiatives? We all have food that is given to us in our workplace. So if we are served healthy food, just to give you an example, in the hospital we are given coffee at regular intervals, and the coffee used to be very sweet. So now from this month there's a new policy where all the coffee will be sugarless. So if you want, you add the sugar. So a small example as to how you can have a workplace health initiative. Another important thing is having some kind of recreation, having some kind of place where employees can walk around. So to reduce being sedentary by just sitting. Health talks is a workplace health initiative. Also, health checkups. So if employees are allowed to have health checkups, if that is facilitated from them, then you pick up illnesses early, and it helps in early cure and it also helps in prevention. Okay, so these are different workplace health initiatives that can be taken about. A small little gym where people can practice, can work out. So one can never overemphasize the importance of exercise. So being active and regular exercise have shown many benefits, okay, and contribute to a long life. It prevents a lot of diseases like diabetes, hypertension, which are heart illnesses, which are major killers in our day and our world. So benefits are, it helps with weight loss, it maintains muscle mass, increases your energy levels, definitely increases your energy levels, reduces the risk of chronic diseases that I've just talked about, improves brain function. Studies have even shown that Alzheimer's and other dementia, diseases associated with dementia, markedly decrease if there is a regular exercise schedule, because the brain secretes hormones that are beneficial to us if we regularly exercise. So the brain loves exercise. So a few tips: remain active throughout the day. So how do you remain active throughout the day? I understand that you all are on your computers. Stand. Just stand and, move around in your cubicle a little bit. Or don't waste time by roaming around the premises, but just maybe a minute or so every half an hour, every 1 hour. If you stand at your desk, you do a few exercises. It will help you remain active instead of sitting. They say sitting is the new epidemic that has happened now. Sitting is something that causes a lot of diseases. Okay. Take short walks after meals. After meals, just a 5 or 10-minute walk is very important. Exercise at least 3 to 4 times a week. Then we come to nutrition. Nutrition is very important. It's unfortunate that the more attractive the food is, the less healthy it is. No, healthy food is not that attractive. It's not that tasty. So consuming a healthy diet helps prevent malnutrition in all its forms, as well as it helps prevent a range of non-communicable diseases. What are the healthy diet that we should consume? Unprocessed foods. Okay, don't consume junk foods. Don't consume processed foods. Raw material that is cooked and that is eaten is the best and healthiest, filled with vitamins and minerals that we need. So vegetables in all our diets, fruit, very, very important, very, very healthy, different kinds of grains, foods rich in protein, okay, legumes, and meals should be balanced. You should have, people say, I'm only, doing a high protein diet, I'm doing a keto diet. It's not good. You have to, your body does need carbohydrates. It needs proteins, it needs fats, it needs minerals, but it doesn't need stuff in excess. So you need to have a good balanced diet for your body to be healthy. Also, salt diets should not exceed 5 grams of salt in a day. Salty things are, yes, tasty, but if we get used to a slightly less salt, it goes a long way in preventing hypertension and heart disease. Intake of free sugar should be less than 10% of the total energy intake. Okay. Next, we come to posture. How do you maintain a correct posture? It's essential to maintain a correct posture to avoid back strain and repetitive stress injuries. So again, because we are sedentary, we're sitting all the time on the computer, posture is important. So tips for a good posture. So can you see this? How he's sitting upright. It's so much more convenient slouching. It's so much more comfortable being this way. But this and this is the right posture to adopt. So what are tips? Don't sit for too long. Get up, walk around, come back. Okay, stand and do some stuff. Sit on the chair properly, stand straight. Do exercises to improve your posture. Place the screen at the eye level, at your eye level, because that helps tremendously towards decreasing eye strain and avoid phone strain. We're all the times on our phone, we're all the time checking messages. It's very, very unhealthy. Use your keyboard and mouse in a proper manner. Okay. So eye strain occurs when your eyes get tired from intense use, such as staring at computer screens from a long time. Yeah. How do you avoid eye strain? So move away. When you don't have to look at the computer, read, use, we don't read anything nowadays. All we do is we read from our phone, we read from the computer. Hard copies are good and healthy. You can moisturize your eyes if your eyes are getting dry. So take short breaks, adjust the lighting. Lighting is important. Limit screen time. Okay. And you avoid eye strain when you're doing excessive computer work. Okay. So you have to have your lighting. You can stand, but make sure that when you're standing also that you're on the same level, your eyes at the same level as the screen. Okay. Another important thing that in this generation we're not getting is we don't get proper sleep. So why don't we get proper sleep? It's not that we don't have time to sleep. It's not that we are working that many hours that we don't get proper sleep. Yes, I do agree. For those doing night duties, our diurnal sleep pattern is disturbed, and so we don't get proper sleep. But otherwise, even after we go home, what do? Sit in front of the television. We're watching the screen. We're working on our laptops. We're working on the computer. We're looking at our phones. And all this compromises on the quantity of sleep that we get. So we have to get enough sleep and good quality sleep to maintain optimal health. What are the benefits of proper sleep? It helps in building stronger immune system. So it is true, studies have proven that if you sleep well, you are less prone to infections. So your body's immune system would be strong and you would not get the dengue even if a mosquito bites you because you will have good immunity. You will not get a cough and cold, or you won't get COVID from your neighbor if you have good immunity. It decreases the risk of weight gain. It results in better calorie regulation, lowers the risk of heart disease, lowers stress, lowers inflammation. So sleeping well is very beneficial. And how it's related to our work. You come to work fresh the next day and you're able to be more productive at work, less stressed at work. So what are the tips for good sleep? Follow a sleep schedule. You'll realize that if you're sleeping at a particular time every night, your body also kind of winds down and you're able to sleep at that time. And if you're used to getting up at a particular time every morning, even before your alarm rings, you're kind of awake. So that is what our body does to us. Our body gets used to whatever pattern we get into. Avoid exercise before bed, okay? Because then you're stimulating yourself. Do not use computers, mobile or TV screens at least an hour before bed. Avoid nicotine and caffeine consumption before bed because that's meant to keep you awake, not to sleep. Keep the bedroom cool, quiet and dark before and during your sleep. Try not to put a light on. And you can use relaxation techniques, a couple of yoga techniques before bed. So now we come to importance of regular health checkups. So we've talked about the importance of nutrition, the importance of exercise, the importance of good sleep, of keeping our eyes well. But having said all that, regular health checkups can help find health problems earlier and hence the chances of cure is better. Okay, so it is beneficial and it's nice even if companies can organize health checkups for their employees in order to prevent as well as pick up an illness early. Yeah. So a health checkup has a lot of different tests that are done, but it is beneficial to make a list of the health issues that you're facing. Okay, review with your family because the doctor will ask you this family history of something. So if you have a list of health issues, every health checkup also has an interview or also has a meeting with a doctor. Okay, so then if you're ready for whatever you have, it's easier for you to ask questions and benefit most from your health checkup. So recommended test for adults would be your cholesterol profile. You all know that. Cholesterol is what actually leads to plaque formation in our arteries. It leads to heart attacks. It leads to stroke. So a cholesterol profile is important. Blood sugar. So we know whether we are diabetic, we are pre-diabetic. Cancer screening, what are the tests that are done for cancer screening? We do certain blood tests. If high, will tell us that there's something happening in the body. A chest X-ray, an abdominal ultrasound. These are simple tests that will pick up if there is anything happening inside us. Vision tests, okay? So you can also have, when you're having a health checkup, it's important to also get an eye check and see, check the eye pressure, check if your eyesight is okay, if there's anything developing, if you need glasses to prevent eye strain. Blood pressure has to be checked. Hemogram, so what is your hemoglobin? What is your total count? How are your white blood cells? How are your platelets? Are your white blood cells healthy? So we come to work-life balance. So this is important for us. Work-life balance is a concept which includes prioritizing between work, which is our career and our ambition, and our lifestyle. So health, pleasure, leisure, family, spiritual development, meditation. So we all need to have a work-life balance so that we give our best at work and we also have a life beyond our work. Why is life beyond work important? Life beyond work is important for our mental health, to decrease our stressors. Okay. So work-life balance doesn't mean that 50% of your time should be at work or 50% of your time should be home. That's not the balance we are talking about. It's not a time-based balance. So all of us who are working, although we know that we have to maintain a work-life balance, you know that it is roller coaster, however much you try. What do we need to do? We need to decrease the amount of roller coaster rides that we actually go through. Okay, so sometimes it's very scary, our work-life balance. Okay, but who's going to work on it? You have to work on it to decrease these kind of ups and downs and lefts and rights that happen. So work-life balance is not synonymous with work-family balance or family support. That's not what we're talking about. We're talking about us giving our best at work, doing all that we need to do at work, as well as having some time for ourselves where we can do the stuff that we need to do. So if we're only working and we are not able to do the stuff that we need to do, then that's what disrupts our work-life balance. Okay? So it's not about hours, it's not about how much time you spend with family, it's how much time you have to yourself to do what you need to do. To give you an example, recently one of our doctors from the hospital were promoted and they were given the position of a unit head in another hospital. And I talked to him a couple of days ago and I said, how are you? So he said, I really don't know what's hit me. I'm so busy with what I have to do. I cannot even find anything at home, you know? So that's about work-life balance. You cannot be at a tizzy at work and then have absolutely no time for yourself. Okay. So does not mean an equal balance, like scheduling an equal number of hours for each of your various work and personal things. Okay, so it's not an equal balance is what I said, because equal balance is equally unrewarding and unrealistic, isn't it? The balance cannot be like this. This is the kind of balance you need to have with satisfaction, not with your hours. Okay, so work-life balance is achievement. So you achieve and you enjoy. So what do you enjoy? You enjoy your work, you enjoy your family, and you enjoy your self-care, whatever you like doing. So that is your work-life balance, where you achieve and enjoy these three aspects of the triangle, that is work, family, and self-care and friends. So why do we have, what's the reasons for imbalance in work and life? Unable to set up priority goals. Okay, so you're not able to prioritize. You're not able to do what you actually need to do. And therefore, you will end up with no time. So when your work life and personal life are out of balance, what's the importance of that? It leads to stress. The stress level is definitely going to soar. Okay, it makes you confused. What do I do? When do I do it? What do I do now? What do I do then? So when you're faced with a situation like this, what do? I believe that you take a paper and write down what exactly you have to do, what is pending, and prioritize. What do you need to do first? What do you need to do second? And then as you do each thing, tick it out. Believe me, it helps. As you tick whatever you have done, your stress level comes down and you're able to feel, and you feel much happier. Okay. So prioritize, make a list, and go with finishing one thing at a time. What do I do to this? Okay. So a few tips to be healthy, mental and physical. One is learn how to say yes as well as how to say no. So, it's when you say yes to everything that's asked, you're doing unwanted tasks. So you have to learn to say no also. Okay. It's easy to say no if you've already committed. It isn't easy to say no. Okay, but it's easier to say no if you've already committed to tasks that if you're already busy and you have commitments. So establish your absence as well as your presence. So set a schedule for being physically elsewhere. So you have to know where exactly you want to be and give yourself the time to be where you want to be. Okay, so yeah. Do a little bit of everything as well as all of one thing. So you have one task that you have to do that task, and the other tasks, do a little bit of the other tasks. No, you can't do only one thing and not do the other things. So I've written master the art of multitasking, but you master the art of multitasking without stressing yourself. Don't be running around your tail. Okay. So determine your tasks as well as your priorities. Many activities, small and large, are the steps that lead to your goal. So if you take one step at a time and one proper firm step at a time, it goes a long way towards actually finishing what you have to do. So work until your time is up, as well as until your task is done. Okay, then you're done. So every task that you have to do, your goal should be to make progress for a specific amount of time. Then move on to the next task and progress with that task. And believe me, you will be able to finish whatever you need to do. So be honest, finish your work as scheduled. So what stops us from doing this? It's fear of failure, a short attention span, poor goals, perfectionism. So I have to do this to perfection. You can't do the other thing. So an obsessive personality will not help us to go ahead and finish all that we need to do. Okay. So set your goals and priorities. Don't be aimless. You have to know what you want to do and how to do it and hit exactly at that point. Okay. So one of the things is to set SMART goals, that is specific goals which are measurable, which are attainable. Don't set something that is not attainable, which are relevant. It has to be relevant to what you have to do and time it. Within that time, you have to be able to finish your goals. So set something which is attainable within that time limit. So work is not where you go. Work is what you do. Okay. So whether you're working, we realize that so much, all the more during COVID, when we were working from home. So see, this is so important. Work is not where you go. It's so true what this says. Okay. So have effective time management for your work demand and personal care. Okay. Don't be Superman. Don't be superhuman. Set your limits. It is okay to say no sometimes. Okay. So it doesn't mean you're saying no to being a team player. It just means you're setting boundaries and you're prioritizing and you have your own time. There's so much technology. Wherever you go, there's technology. but you use your technology wisely. Don't be a slave to technology. There are times when our phones have to be kept away and not interfere with our personal relationships. Now, if I'm not saying only friends, even at work, you're talking to somebody and the phone rings. So keep your phone at bay when you're doing a few important things. Okay? Take care of yourself, health and leisure. Adopt a positive lifestyle. So what does positive lifestyle mean? Physical activity, which we've talked about, balanced diet, sleep, relaxation, good personal hygiene. Recognize emotional, social, and physical relationships. Avoid smoking, alcohol in excess. Okay, have a good environment and always seek information, seek support when you need it. Okay, so eliminate stresses from your life. How do you do it? You change your mindset, avoid extreme ends. That eliminates stressors. Don't be distressed because of what's happening around you. There'll be lots of things happening around you. Don't let that distress you. Don't be distressed, de-stress the stress, okay, which is important. So be concerned, but don't be anxious. There is good stress versus bad stress. You can be concerned. Anxiety is bad stress, okay? So when you feel worried, ask yourself, ask a question. Can you do anything about it? Apply the rules of 4 A's. What are the 4 A's? Avoid, alter, adapt, and accept. Okay. Avoid what you can, alter whatever you can, adapt to what you can't avoid and alter, and then accept what has happened. Okay? So it makes no sense about worrying about things that you can, which you can control or which you cannot control. No? Worrying does not change anything. Okay? Yeah. The next is socialize. Socialize, meet people. That break is very important. Do mindful meditation. It helps your brain to reprogram your subconscious mind. Focused breathing is important. Talk to friends, get connected. And relationships at work. Good relationships with colleagues is very crucial. Open discussion is essential to encourage positive relationships. So it's important to have good, healthy relationships with our colleagues at work. Otherwise, if there's tension between two people, you don't feel like going to work. So relax, practice relaxation, watch your sleep, be mentally and physically fit. Just as your car runs more smoothly and requires less energy to go faster and further when the wheels are in perfect alignment, you also perform better when your wheels are in alignment. What are your wheels? Your thoughts, your feelings, your emotions, your goals, your values. When all these are in balance, so much easier, you perform better. So you are not perfect. All you can be is your best. Be your best at work. Be your best at home. Even if you can't spend the time you want in an aspect in your life, just see who that is waiting for me. Tell them I'll come in 15 minutes, 20 minutes. Even if you can't spend the time you want in an aspect of your life, be your best at it when you are. Okay, so what I'm trying to say is be in harmony. It's easier said than done. But you just remember, you cannot be perfect at everything. But you can be in harmony. You can try your best and do the best that you can do. Okay, so a little exercise. It's time to exercise. This is how you exercise. And I thought, what exercises do you do? Activities that involve repetitive movements of large groups of muscles. So 20 minutes up to 3 times a week. Exercise lowers your body's stress hormones. That's cortisol. It releases endorphins. Very good for your brain. And it also improves your sleep quality. Okay, so all of you, I guess, are sitting. So can we just for a moment do a small little exercise? So sit on a chair with your forearms supported on the armrest. Push yourself up until your arms are straight. Okay, so do this. See if I'm doing it. Do it this way. Just arms are straight and support yourself with your feet as much as needed. Keep your elbows straight. Keep your trunk upright. So just do it a few times. Easily done, no? In your workplace. Yeah. So keep doing it just a few times. So this is one exercise that is easily done. Okay. Heel raise. This is also important. So stand tall with your weight distributed evenly on both your feet. So just raise your heels. Just raise your heels. Okay. And then come back to the starting position. So do this a few times. It's doable in your cabin, in wherever you are, it's doable. I just put two exercises I thought easily doable. And this is to create a good workstation. Same things that I've said before. Eyes at the level of the monitor. Okay, a good chair. Sit straight, do not slouch. Okay, so mind your posture, which is important. Okay, so now with this, we come to the basics of first aid. So in your workplace, there'll always, although we've talked about safety, we've talked about avoiding accidents, there will always be something that happens. And you have to be equipped to handle different things that happen. So good knowledge of first aid would be important. So what knowledge? So basic first aid for bleeding. Someone is bleeding. What do you do? If you're interested, I can take a full session on first aid at a later time. Today, there won't be time to talk about first aid. So just a few slides I put. So basic first aid for bleeding. Remember, any kind of bleeding with good pressure would stop. Okay. Basic first aid for burns, we need to know what do you do when you're burnt. The thing is to put that burn. See, if this is the part that's burnt, put it in tepid water, that is in tap water, not in ice water. Okay. Basic first aid for blisters. What do you do when you have a blister? For fractures, you need to immobilize a fracture. And in the position of comfort, immobilize it, because the more you move, the more the damage that occurs. Basic first aid for sprains, for nosebleeds. What do you do when you have a nosebleed? You sit forwards like this lady is doing, and you press one nostril at a time, or you can press both your nostrils. Okay, breathe through your mouth, and you keep it pressed for 10 minutes for the bleeding to stop. Okay. So a workplace emergency is an unforeseen, unknown situation that jeopardizes your employees, customers, or the public. Now, we talk about cardiac arrest that happens in a workplace. Okay. So what are the risk factors for a heart attack and a stroke? The risk factors for a heart attack and a stroke. What happens when you have a heart attack? The vessels, the arteries that supply blood to the heart get blocked with cholesterol, which forms plaques. Similarly, when you're having a stroke, you're paralyzed. One part of your body gets paralyzed. Why does that happen? That happens because the vessels that are supplying blood supply to the brain get blocked. So who is at risk for a heart attack and stroke? It's genetics. So say your parents are, or your grandparents have had heart attacks and strokes, you're at risk for it. Can you change your genes? No, you can't. But what can you do? You avoid the other things that are happening. So smoking is a big risk factor. High blood pressure. If you have a high blood pressure, treat it. High cholesterol, you can treat it. Diabetes, obesity, it's quite possible to to work on your obesity, stress. So all these are risk factors. Only genetics we can't change, but everything else we have control over. So this is what happens to the vessels. There's plaque formation, like you can see, and then the vessel gets blocked. So once the vessel gets blocked, then there is no blood supply to the brain or to the heart. So what are the signs of a heart attack? Persistent chest pain or discomfort. So it might be chest pain, it might be discomfort that's not relieved by rest or by medication. It can spread to the neck, the jaw, both the shoulders, the arms, the back, upper abdomen. You can have sweating with it, nausea, vomiting, breathlessness. So you have to recognize the signs of a heart attack, keep the victim comfortable, comfort him, make him de-stress him, call for a doctor. If the patient is taking any medication, give it to him. You don't medicate the person, monitor him, and be prepared to give CPR if his heart stops beating. So a heart attack is when the heart muscle does not get proper blood supply. It is not the same as a cardiac arrest. Okay. So similarly, for a stroke, where the brain does not get proper blood supply, recognize the symptoms and signs of a stroke, shift to a hospital as soon as possible, and remember that time is brain. So this is a stroke scale, which everyone, so you can diagnose a stroke. Everyone can diagnose a stroke. See if the facial droop, ask the patient to smile. Normal, both sides of the face move equally. Abnormal, one side does not move. Speech, ask the person to say a simple sentence. So if he's not able to make a simple sentence, if he slurs, you know there's something going on. Just tell him to hold the arm out for 10 seconds. Okay. So both arms hold out for 10 seconds and see if both arms move equally or not at all is normal, or one arm will drift down. So you know that the person is having a stroke. Okay. So I thought just a little bit about CPR. How do we give CPR? So what is CPR? CPR is cardiopulmonary resuscitation. Cardiac is heart, pulmonary is the lungs, and resuscitation is to keep the person alive. So when the person's heart has stopped beating and he is not breathing, okay, that is called a cardiac arrest or a cardiorespiratory arrest. Now, how do we approach a person and how do we see if the person needs to be resuscitated or not? The first thing is to assess responsiveness. See if the person is responding. Before you even do that, check if the scene is safe. Okay. So if the scene is safe, then you check to see if the person is responding. If the person is not responding, then you will call for help, because you cannot do CPR yourself. You need help to do CPR. Okay. So what did I say? First, you see if the scene is safe. Then you check if the person is responding. If he's not responding, you call for help. At the same time, you look to see if the person is breathing. Okay. So if he's not responding and he's not breathing, then what you do? Then you have to start your CPR. Okay. So if he's not responding and he's not breathing, then you have to start your CPR. It's not moving. One. Okay. So I'll just play this again because it stopped. I want to show you the pictures that I have over here. So this is the ABC, which is the airway, breathing and circulation. And DRS, D is for danger, R is for responsiveness. And S is to shout and see if the person is responding. So you shout loudly and see if the person is responding or not. Okay. So this is what he is doing. He's shouting and seeing if the person is responding. Are you all right is what he is saying. If the person is not responding, then you shout for help, because it's difficult to do CPR all by yourself. Then you check the airway. See if the person is breathing. Okay. How do you see if the person is breathing? You can see what she's doing. She's lifting the chin and tilting the head, and she's looking at the chest. She's looking for a chest rise. Okay. To see if the person is breathing or not. So that is how you check. You check to see if the chest is rising. So if the chest is rising, then you know that the person is breathing. Okay. So you look, listen, and you feel. Then what do you do? The next is, this is how you're calling for help. So you either, when you call for help, you have an ambulance that comes, and at some point of time, the ambulance is going to come and take you to a hospital. Okay. Then you need to see if there is circulation. So is the heart is not beating. So there is no circulation to the brain. There is no circulation to the heart. So you need to to produce circulation. So you put your hands like he's doing at the center of the chest, and you push hard and fast at the center of the chest with your hands straight, with your elbows straight. You do it 30 times. So you give 30 chest compressions to make at a depth of 5 centimeters. So you need to compress the chest at a depth of 5 centimeters. Then you give the person 2 breaths. So it's 2 breaths and 30 compressions. Okay. So he's giving mouth-to-mouth respiration. But if you cannot do mouth-to-mouth respiration, then you just continue with the chest compressions only. If you're doing mouth-to-mouth respiration, one is doing mouth-to-mouth respiration and one is doing the breaths, then you can always swap. Okay, when you're tired, giving chest compressions. If you're not able to give chest compressions, then you can just continue to do the hands-only CPR, that is only chest compressions, if you cannot give the breaths, because it's not easy to give breaths. And there is something called the automated external defibrillator, which will deliver a shock to the patient. Again, lay people can use it. All companies can keep it. What does it do? When our heart stops beating, most often it is a ventricular fibrillation. Okay, so if you shock the patient, you can get the heart back. So it's an automated external defibrillator. Lots of companies have it. You require a little training to use it. Even in the Bangalore International Airport, these AEDs are there. Okay, so they can shock and help you start the heart. I'm saying lay people can use it because it's a computer inside that. So it tells you whether a shock is required or not. So to conclude, safety is everyone's responsibility. Be proactive, identify and eliminate, minimize hazards to make the workplace safer. Only when all concerned work together, we can have a safer workplace. There are reasons why rules have been laid down. It's important that we adhere to these rules, and it is not possible to predict an emergency. So it's important to have a first aid kit to the workplace. Everyone should know where it is. Everyone should know what it contains. And also a plan of action to face an emergency. Again, personal hygiene is an individual responsibility. Management provides the same, gives you right infrastructure, creates a culture of hygiene. It's necessary to break the chain of transmission. So to cough and sneeze properly without, sneezing on everyone else, coughing on everyone else. And whatever plan is there in your institution, in your workplace, you need to follow it. So you have to have a strategy that puts hygiene as a priority. So focus on your health. It's important to avoid diseases. So we spend a large part of our life in work, and that can impact us. That can impact us in a good way as well as in a bad way. Okay. So regular physical exercise will reduce the incidence of diseases and make a person more productive. Regular health checkups are very, very important. Okay. So
Thank you so much, Doctor.
Okay. And one more thing I want to say is CPR has to be done hands-on. Okay. So if you're interested and you talk to us, then maybe we can come there and make you all do the CPR yourselves on mannequins. So that's the best way to learn CPR. Okay. Thank you. Have a nice weekend.
Thank you so much.